Hello, everyone present here. This is Apurva from Mom's Belief. I hope you all are safe and well. Today we have Dr. Diptanshu Das with us. He is an eminent pediatric neurologist and developmental pediatrician based in Kolkata. He is the co-founder of Institute of Neurodevelopment and is a consultant at Institute of Child Health. Today he is going to tell us about sleep disorder in autism. Epidemiologic studies indicate that up to 50% of children experience a sleep problem and about 4% have a formal sleep disorder diagnosis. Let's learn from our expert to know how you can help children with ASD and their disturbed sleep cycle. A very warm welcome, doctor. Thank you for joining with us today. Now, without any further ado, let's start the session. Over to you, sir.
Thank you. Just a moment. Hi, everybody. I'd like to know how many of you are parents of children with autism. Can you people raise your hands? Okay, great. And how many of you are not? For the people who have raised, can you lower down? And for the others, can you raise up? Okay, great. Thank you, everybody. If you are a parent of a child with autism, you definitely know the hardships. Uh, it's very common for children with autism not to just Apurva, can you place me on spotlight?
Yeah, sure.
Okay, thank you. Okay, the thing that I was mentioning, just a minute. Just give me a minute. Okay, hello everybody. So today coming to the topic about sleep disorders in children with autism. It is a big problem faced by the parents of children with autism. The reason being, it's not only one person being affected. The sleep of the child being affected also affects the parents, and ultimately it takes a toll on their work, how the children are being taken care of. So this is a problem faced by numerous people, and autism does have a problem involving sleep, where the onset time is delayed. It's seen that something like 11 minutes of delay compared to the overall population is seen in children with autism. And other than that, the onset, apart from the onset, the frequency of remaining asleep, number one. Number two is for them to wake up early. These all are present. So number one, the child goes to sleep late. Number two, wakes up in between. Number three, has a disturbed sleep and wakes up early. So all these are there. And how do they make up? They make up with daytime, increased daytime sleep. So this is a pattern that needs to be broken. Furthermore, the REM sleep, which is a stage of sleep where the memory consolidation occurs, this is reduced in children with autism. So that way, ultimately, the children do not get a good scope to consolidate their memory. This affects their learning. The children with autism, they have a behavioral pattern that needs to be broken. The first thing that I'll mention here is the interventions that are needed. The first thing is behavioral. So, when do we really go to sleep? When we are sleepy? Not really. We need to go to sleep the when it's time. Now, if say you as a parent are going to sleep at 12 at night, and you're putting the child to sleep at 10 at night, so the child might not like to sleep at that time because the child is feeling playful. So it's very important that a particular bedtime is associated. And if that happens, ultimately everybody is going to sleep together. Ultimately, the uh, child has the tendency to go to sleep at that point of time. Not only that, there are other things that you need to take care of. For example, taking the child along, reading out stories, avoiding screen time, avoiding tea and coffee, avoiding a lot of drinks before uh, it's time for bed. So these are simple things that need to be done. The bed needs to be de-associated from any other thing apart from sleep. Often it happens that everything from studying to playing, everything happens on the bed. So this is not a bed where the child is going to sleep. So if you want the child to sleep well, you'll have to de-associate all these things. So these things have to happen elsewhere, and the child comes to bed only for sleep. That way, the mind is primed that when I'm going to bed, I'm going to sleep. The next thing that happens is the next thing is that happens is you need to keep the bed and other things as eye soothing as possible. The child might be fascinated by cartoons and things like that. So in that aspect, it's very important to decorate the bedroom in a soothing manner, so that the child could take a glimpse, be happy about the things around, and automatically that gives them the incentive to go to sleep peacefully. Daytime sleep also needs to be reduced. And the other things that happen is the child often has uh, what should I say? The parents have a anxiety which affects them. So if you are continuously asking the children, come go to sleep, ultimately it's going to screw up the pattern. Rather, if you can console them and put them into a relaxing mood, it will help better. These are simple steps that can be done, and these are going to help. The problem in children with autism occurs due to certain genetic factors. There are other factors as well. The genetics is related to the genes related to sleep being affected. There's a hormone called melatonin, which is often quite low in children with autism. And so, if you can supplement these, it can help. The light exposure is a stimulus that is related to sleep. So if you can reduce the light exposure in the evenings, particularly before they're going to bed, if you can dim the lights, if you have a system where the light is relatively lower before that, it automatically creates a mood that the child is going to sleep. Use of melatonin can be done. It's actually more important than you think, because ultimately, if you do not take the interventions properly, this is going to affect long term. So these are simple things, and rather than going into a lot of technical discussion, I'd be happy to go into individual discussions about what problems you are facing, and I'd be happy to provide inputs. So If you people can raise your hands, who else, who is willing to put up your case, maybe I could help. Okay, I can see Prasenjit Ghosh. Uh, uh, I can see others raising their hands. Prasenjit Goswami, could
Yeah.
you unmute yourself and talk?
Yes, sir. Good evening, sir. So,
Good evening.
yeah. So my child is hasn't yet been labeled as autistic. He's 2.5 years old, but he's at
Okay,
a high risk of autism. And
okay,
the sleep disorder is definitely something that I'm dealing with. We haven't thought in this angle earlier, but now that formal uh, you know um, identification is in process, we can relate to this. My child sleeps very used to sleep very late, and used to maybe at around 1:30, 2 o'clock, and will like to sleep till 11:30, 12 in the morning earlier. Okay. But from the time when we have started getting into treatment, I had been giving efforts to streamline his routine. So we don't prefer to give him more than 1 hour of sleep in the afternoon, and we try to put him in my lap and with lights dim, and try to put him onto sleep from 11:30 in the night, so that he gets to the sleep mode by 12:30 types. So it was working well. But again, for the last 1 week, sir, whatever you do, he will not sleep before 1:30 in the night, and he will wake up in the middle. Okay. And that is really affecting everyone, because we are also involved.
absolutely. Thanks for putting up your case. Let me tell you a few things here. Firstly, it's very good that you're trying to limit the daytime sleep, but at the same time, if you let the child sleep till 11:30 in the morning, the requirement is met. So that way, the child will automatically like to sleep late. What needs to be done is gradually reducing the sleep there. So when this happens, maybe the child will have a tendency to sleep in the afternoon. Even if you allow it partially initially, you could reduce the gradually bring down the wake time. I mean, you could make it earlier.
Okay.
So if you can make the child wake up earlier and play more, probably the child will have a tendency to
Okay.
go to sleep earlier. The other thing that I could suggest is you could make use. Definitely, this has to be done under care of a doctor uh, who has specialty understanding in this field. I could help you in this regard. So, in such a case, what I'll suggest is get the assistance of a doctor. He could use low dose melatonin in the evening, not right before going to bed. Maybe at 5 or 6 p.m. in the afternoon, very low doses, and
Yeah.
that could help in readjusting the sleep cycle. The sleep would the onset would be earlier. So that way, I think that would be better. The
So two
other thing,
questions.
yeah,
So two questions related to this. One is, we have tried waking him up earlier, but then the problem that we land upon is that he will still find a way to sleep some in the odd times. For example, he will sleep at 9 p.m. in the or 8:30 p.m. in the evening, and then even if you try hard to play with him, he will fall asleep somewhere in the middle. And second question is, sir, this low dose melatonin will not be addiction kind of thing, right? I mean that without that
no,
medicine he will
this
never
is
sleep.
not a addiction causing medicine. So no, addiction would not be there. But at the same time, uh, there's specific monitoring that needs to be done. Something that I cannot sum up in a few words only. But I think this is dealable. This has to be dealt with, in fact. Otherwise, the pattern gets affected.
Right, sir. Yeah.
Yeah.
Thank you.
Ivan's mother, could you take it up? Could you unmute yourself?
Yes, good evening, sir.
Good evening.
Sir, same is the case with me. My son is not diagnosed with autism. He has global developmental delays. He's a syndromic child. But yes, right from the starting, sir, he's used to sleep late in the night and wakes up by 8 or 9 in the morning. And sir, but my tension is, sir, he wakes up around a minimum of 6 to 7 times in the night. And sir, at that time also, we need to take him in the lab. We give him the rocking thing. You say, we rock him up, and then he goes off to sleep. Like
Uh,
this is, sir, for us this is very tough. Like this is for every night's condition.
Absolutely. I completely understand your scenario. And as I mentioned, that this happens in children with autism. What happens
Sir,
is
no, sir, he's not diagnosed with autism.
sorry, my apologies. But even for children with who are syndromic, who have other neurodevelopmental issues, as you mentioned that the child has neurodevelopmental delay. So
Yes.
ultimately, he is in the same basket as for other children with autism. I completely understand that your child has not been diagnosed with
Yeah,
autism,
I
but
understand, sir. Yes.
yeah. Uh, in such children, let me get into the general scenario. We have
Mhm.
two hormones. One is called orexin, and the
Mhm.
other is melatonin. Orexin
Mhm.
is basically the hormone that is related to being awake, and melatonin is related to falling asleep. Now, there's a
Mhm.
circadian rhythm, that is the a
Mhm.
diurnal rhythm that occurs, and these hormones follow a particular pattern, and based on that, we go to sleep. These patterns are disturbed in children with neurodevelopmental problems. So, in that aspect, the pattern needs regularization. This is something that has to be done carefully, maybe with use of medication, maybe with non-pharmacological interventions. I've just briefly touched upon the behavioral things that we do. In case of children who are out of India, it's a pattern that the child sleeps elsewhere. In India, the pattern is different. The child usually sleeps with the parent. So,
Mhm.
in that aspect, the interventions that are given outside are going to be different in our case. But at the same time, uh, unless you identify this as a problem, which you already do, uh, it's difficult because somebody might feel that, okay, this is something that happens every night, as you were mentioning, and there's nothing we can do about this. Things need to be done so that the child can grow up better, and ultimately you have your life. It's your life
So what
which is
can
getting
better be
affected.
done, sir, for this? Any kind of.
I think medication is required. I'd suggest the use of medications here. Once again, for your child, the dose and which medication would be best. These are things that the scope does not allow me to discuss specifically about you. But these are things I think it would be great if you could be under the follow-up of a child neurologist or a developmental pediatrician. And people like me could help you how to deal specifically with the case.
Mhm. Also, sir, I have heard of a few oils like magnesium oils and something. Sir, people say there are things which, sir, actually, my son, he's hypertonic.
Okay.
Sir, many of them they have recommended that I should use magnesium oil massages, very light or very soothing massages before he goes to bed. Sir, is that so? Will they help it?
No, I'd suggest it a bit differently. Look, the oil, whatever you apply on the skin, is not really absorbed through the skin. It just makes your skin shiny. So I have real doubts whether this magnesium is going to make it to the bloodstream. Now, since your child is hypertonic, you need to understand that the child needs exercise, and this exercise needs to have a pattern. So, if you exercise the child in a particular way, the child will possibly get tired, and the child will go off to sleep. So, if this can be utilized properly, if the exercise exhaustion as well as the relaxation from exercise, it's very important to understand that the exercises also bring relaxation. So that relaxation often puts the child to sleep. So this is where I'd emphasize rather than use of any oils. The hypertonicity needs to be brought down at any cost, and that means a lot of exercises. Somebody might tell you exercise twice a day. It's not adequate. Uh, what you need is to make a custom plan for your child and go about accordingly.
Okay, sir. Okay, thank you, sir.
Thank you. Any other person would like to ask something? Okay. Parthosi, could you unmute yourself?
Sure. Yes. Good evening, Dr. Das. It's nice to see you, and thanks for all the good advice you are giving us. So our experience also pretty much same as the previous speakers, and so I don't want to repeat them, but just we often get curious to know that how much sleep you think that is adequate for a boy who is 2.5 year old and who is likely likely to be a autistic child. So how much sleep do you think he should take at night, and also the same for during the daytime, because then we can also plan accordingly, because normally the our boy, he sleeps long during the daytime, mainly in the afternoon, and as you suggested that that might be affecting his night sleep. So we have taken a note on that. So if you just give us some kind of idea that how much you should sleep during the daytime, and what should be the right figure for the night. Thank you.
Okay. In this case, what I'd suggest is there is no particular figure. Usually, with age, the sleep comes down, but in case of a child, often the child sleeps 9 hours, 10 hours a day. It could be that your child is sleeping 6 hours a day. That could be okay too. But what happens is the child tends to sleep more often in the day, as you have mentioned. So, if you calculate the total sleep that the child is having in a day, and then try to modify the sleep patterns. There are certain patterns which can be used to modify sleep patterns. It is an elaborate discussion, and the discussion will not provide me that much scope. But uh, use of sleep diary is very important. If you chart exactly every time the child goes to sleep, how much the child is sleeping, whether the child is waking up in between, the pattern can be modified. And the way this can be modified has both the behavioral as well as the pharmacological interventions. So, rather than trying to understand how much nighttime and how much daytime sleep should be there, we'll have to understand that the total sleep required in a day is roughly constant for that child. If there's less sleep, the child will be tired and a bit off during the day. This is something that needs to be prevented. And the way we play with the child influences this. So, if we can really set the pattern in such a way that the daytime sleep is reduced, maybe the nighttime sleep will go up. The rest needs to be dealt pharmacologically. So, even though I've not addressed your question precisely, I understand. Uh, there's no single answer that can be given. It could be that 6 hours is enough for your child. Uh, for a detailed answer, I'd have to go through the sleep pattern, the sleep diary, and then I can comment.
Okay, thank you. And also, he demonstrated the same behavior that at night time he wakes up around 2 o'clock or so, and then he remains awake for 1 hour, and then he falls asleep. 1 or 2 hours, and then he falls asleep. So
This
as if
is
we
yes.
also wake up, and so it causes some kind of issue. Yeah.
This is actually very common. What you're saying, uh, the way we deal with it affects it, and due to these sleep patterns, I think the use of medication is required. Somebody might be apprehensive whether there be a habit formation related. Now, we need to understand there are certain medications which have a habit formation involved, but there are others which do not. For example, the drug that is melatonin is basically a hormone produced by the body. What you're giving is just a synthetic analog of that, basically a synthetically produced molecule that your body produces anyway. So that way, it's not going to harm your body. I think, in a nutshell, that's it.
Okay. And doctor, just a follow-up question: that
So,
do you think that making him tired by sending to park and having making him play for long hours can help in any way? I mean, although in current situation it's difficult, but
the answer The answer here is actually yes. Uh, and as in case of a previous attendee who had a particular question to ask, I mentioned that the exercise pattern, the way you do that is important because when you exercise the child gets tired. At the same time, the child feels relaxed. So both of them are there. Now, if you put the child to bed, it could be beneficial. So when this is done, when exactly affects. So I think this can be made use of.
okay, thank you.
There are users who have joined in between. They might have missed the main discussion, but if they have any question related to the sleep patterns of their children, I think they could ask. Anish Agarwal has raised his hand. Could you please
Good evening,
unmute and
doctor.
ask? Good evening.
My child is 2 years 6 months old.
Okay.
She has been diagnosed with early symptoms of autism.
Okay.
Main issue is that she can't sleep alone. If she don't find anybody by her side, she gets up in 15 minutes and she come out of the room crying. So if somebody is sleeping with her, then it's okay. Otherwise, it is very difficult to make her sleep.
Now tell me something.
Yeah.
In your case, since it varies with the Indian families, does your child sleep alone or does your child sleep with you?
No,
What is
no,
the usual pattern?
she sleeps with us.
She sleeps with you. So,
And the issue is that she sleeps around 2 hours in the afternoon and around 11 o'clock in the night. So,
okay. And
though her sleep is always disturbed, but especially when she's alone, she can't sleep. She
fine,
comes out crying every time if she's sleeping alone in 15 minutes or so.
fine. Tell me something.
Yeah.
When do you people go to sleep?
Around 10:30.
So you people go to sleep with your child.
Yeah.
Am I correct? So
Yes, yes.
how does the child find herself to be alone?
In the afternoon, in the afternoon.
Okay. If the child is not sleeping much in the afternoon, I'll consider it good. Rather, keep the child engaged. Let her sleep for brief periods, maybe half an hour. I think a soothing music or a personal touch in some form does not necessarily need to be a personal company. For example, the mother could be working in the same room in close proximity, and even if the child gets up, she could just cuddle, and I think that will reassure the child. So
No.
I think
Even a slightest of the movement wakes her up. And
that
whenever
happens.
she wakes up crying.
Yeah,
And
this is indicative of an insecurity. The insecurity issue needs to be resolved, and needs a behavioral evaluation about what exactly is making him or her insecure. So these are things that we need to understand. Now, there are things that a parent needs to understand. Uh, Although I understand I'm going a bit off the topic, but let me tell you certain things. There are parent training programs which are very important. Unless you know how exactly to deal with your child, unless you know what care will make your child respond, this is very important and often neglected. There are limited number of programs in this aspect. Uh, there's a WHO caregiver skills training program, which we at Institute of Neurodevelopment operate, and we provide such trainings. If you want, you can get in touch with us. We'll schedule you for the next match. This is a training program where the communication as well as the behavioral issues of the child are addressed. And more importantly, what is done is it's not really the child's behavior that we try to modify. It's the parents' behavior that we try to modify. And there are parents. I think there's one parent here who is a part of the training. Can any of you who have participated raise your hand? Maybe Pamida ma'am or Abraham, uh, anybody who has just unmute yourself and mention about the program. I think that will be better. There are a number of hands that have come up. Just unmute yourself and start talking. Sushmita Chakraborty, you could unmute yourself.
Hello, doctor.
Yeah.
Yeah, I participated in this program, and it's just amazing program. Uh, the way they teach us that how to deal with our kids is really is very good, and it's my child. He's improving a lot after this program, and after this training program. It's helping us a lot.
Okay. Thank you, ma'am. Other than that, Mr. Goswami, could you also unmute and mention a few things?
Sure thing, sir. Yeah. So I'm part of the WHO caregiver skills training, and the training is very much focused, as sir mentioned, it's focused on we caregivers and not the baby, because there are a lot of mistakes that we do, and more than mistakes, they are scope of improvement that we as parents can consciously bring in, and it does impact the child. Um, uh, you know. Uh, it's all about belief. If we religiously believe what the trainers are saying, because it's based on a naturalistic environment. So it's an evidence based naturalistic way. So they have tested it on many people, many kids, and they have seen behavioral changes due to those disciplinary changes on the caregiver side. So but they are giving tips from those sides. So it starts with communication related theories, and then goes to behavioral, and the sequence itself says a lot. So behavioral is dependent on communication. So once your communication thing improves, the behavioral changes will come into play. So it is definitely going to benefit any parents who is dealing with hard times on neurology. My That's my personal perspective.
Yeah, thank you for the details. Mr. Agarwal will get back to you on this, but just understand that unless we do the right thing, the child's condition would not improve. So, deeper understanding of the subject is needed. Uh, we definitely try to grow the understanding. You can reach out directly to me. My number is given below, and also if you just search for me you'll get the details on the internet. So I'd also try to reach out personally to you with the details. But there are behavioral patterns that need to be brought in the parents, which is going to affect the sleep patterns, and not only the sleep patterns, the overall behavioral patterns of the child. And unless we bring that, bringing out the best of the child, not possible. So changing ourselves will actually help us to bring the best out of the child. Thank you. Any other questions that we have? So should we wrap up for the day?
So, can I ask the question?
Definitely.
Okay. What is the problem of my child? He actually urinate while sleeping. Will I need to take help any medicine?
May I ask the age of the child?
8+.
8+. So definitely interventions are needed here. This is not something that can be done right away. Although out of the direct scope, what we say, once again, there are behavioral interventions that we bring in the beginning, and only after that we go for medicines. There are simple things like use of bedwetting alarms, which can make a lot of difference. So if the child is passing urine at a particular time of the night, you could make a note of the time. Suppose it's at 2 a.m. At night, you could make a schedule to wake up the child at a time prior to that, maybe at 1:30, and take the child to pass urine, and that way I think that can benefit. There are other interventions as well. In a nutshell, this is one simple thing that is very commonly used and is effective. The other things like restricting the intake of water prior to bed, avoiding screen time. These are simple things which usually help.
Okay, thank you.
Okay, my pleasure.
Dr. Das, I have one question.
Sure.
You mentioned earlier that if we can reduce the liquid intake as well earlier before sleeping, it might help. So, sir, does it also include water? Because we kind of get a feeling that maybe when my baby wakes up in the middle of the night, he's probably thirsty.
Yes.
Okay. So, do we give water before sleeping, or should we avoid?
At the same time, the other thing. No, you can give water before sleep. That's not a problem. Quenching thirst is one thing, but giving a lot of fluid after 5 p.m. could make the child have an urge to pass urine in middle of night. So that is a pattern that needs to be avoided, and that is the reason you need to avoid a lot of water after the what should I say, after evening.
Yes, sir. Thank you.
Any other thing? Any other person having any queries?
Do we have any other queries? Participants? Okay, so shall we wrap the session, sir, Doctor?
I think we can wrap.
Yeah, okay. So I would like to thank you for this interactive and informative session, Doctor, also for joining with us today. And I would like to thank you to all the parents and professionals for joining with us
Thank you.
today and making it even more interactive. We hope you all have gotten your answers. Now we shall see you next time. Thank you. Have a good day.